Thank you. Well, welcome everybody. And this workshop, as Dan mentioned, is based on the harm reduction guide coming off psychiatric drugs. And we're going to be discussing exactly what a harm reduction approach means and talking about that today. Also, I want to apologize that I don't have amplification with all the chaos with the lights, and the storm apparently is responsible for a power outage in the whole district right around here, just the whole area, the whole neighborhood, not just the hotel. So we're making do with the best that we can with the change of rooms and the lighting and everything. There is a lot of information about my work, including a lot of resources around medication as well as trauma issues, and also ways to contact me at willhall.net. If you have questions, I'm also available for speaking, doing work and trainings in the future. Please feel free to contact me. Just go to willhall.net. And I'm going to be presenting for about half. I guess we have an hour and a half. I'm going to be presenting for about half an hour, 45 minutes, and then I want to really give all of us a chance to have a good discussion, to ask questions. To be clear, this is not about medical advice. I'm not a doctor. I don't give medical advice. This is an educational workshop, so that we're all better informed, so we can help ourselves, help each other, help others in the process of exploring medications, how they're useful to us, how they might not be useful to us, how we might want to explore coming off or reducing medications. So, very important to welcome everyone here. This is not an anti-medication approach. I myself am not anti-medication at all. I am pro-good science, good medical research. You just heard a wonderful speech by Robert Whitaker, a historic speech by Robert Whitaker here at the Alternatives Conference. He's the author of Anatomy of an Epidemic, Magic Bullets, Psychiatric Drugs, and the Astonishing Rise of Mental Illness in America. And let's be clear, the scientific literature, the medical research, if we're honest about it, does support that many people do well on medications. Many people do well long-term on medications. And for that reason, I'm not anti-medication. I know many people who are doing well on medications, who feel helped by their medications, who are supported by their medications. And so this is really about what works for people, because the reality is, as we know from the scientific literature, as the research is also, we know from talking with each other and our own personal experiences, that the medications don't work well for everyone. A lot of people are helped by medications, and a lot of people are made worse by medications. So coming to terms with that is what this workshop is about. And the guide that you all are free to take, the harm reduction guide to coming off psychiatric drugs, is available free as a download on the internet, and you're free to take that and put it on your websites, to print it out, to distribute it. You can use it to raise money for your organizations. Completely open, Creative Commons, open source, free copyright. You have permission in advance to go ahead and print it and distribute it and make it use. Y también quiero decirles que hay este guía en español para hispanohablantes. Entonces, si hay hispanohablantes en tu agencia, en tu grupo, en tu comunidad que se necesite esta información, se puede bajarlo a la vez también con el otro en inglés en el sitio de web. We also have an edition in German. So I was just saying there's a Spanish edition and also a German edition. We're working on a Danish edition. Right now I have someone working on a Japanese edition. So please feel free to distribute it and use it. I'm going to try and really give you a condensed version, but everything that I'm going to be presenting here is in the guide. And this guide, really the harm reduction guide to coming off psychiatric drugs, it exists to fill a gap. It exists to fill a gap. When I was one of the co-founders of the peer-run organization, the Freedom Center, in 2001, we had many, many people coming to us saying, these medications aren't working for me. How do I get off of them? Or I tried to get off and I couldn't. You know, can you tell me what's going on? Or is it possible to get off? My doctor says I can't get off. I'm not allowed to get off. There's just so much misinformation. And so if you look in the thank yous for the guide, this is a small sample of the number of people who were involved. There were about 40 different collaborators. It was an incredible collaborative group and collaborative effort of people who have been on medications, people who have been in the mental health system, Doctors, psychiatrists, nurses from several countries were involved, holistic practitioners, acupuncturists. If you turn to the back, there's a list of health professional advisors, including Daniel Fisher, who's one of the editorial advisors. Alexander Bingham is here, one of the editorial advisors. And there's a whole list of folks who were involved with this. This was really a collaborative effort. I was really the person who synthesized all this information because we had been doing this work for years and there wasn't easily, readily available information. We felt like we had to put this guide together. It was filling a gap because, as you know, there's a lot of talk about going on medications and staying on medications, but there isn't a lot of information about coming off. And there's a lot of different reasons for that. One is because of the way in which there's a tremendous scientific and medical professional consensus that medications are the answer. There's also the pressure from pharmaceutical companies marketing. So there's a gap of information. And that's really all we're trying to do here is to fill this gap. And I also encourage you to give this guide to your providers, to your doctor, to your prescriber, to people at your agency, your nurse practitioner, people in your family, to educate them about what these issues are all about. So if I was to have a single message that I'd like to give to SAMHSA and the federal government and the folks who set mental health policy, it would be clearly we need research on coming off medications. We need good, solid research. It has not been done. It has not been done. This is based on personal experience. It's based on some research that's out there, especially some research from the UK, the organization MIND, that I'm going to be talking about a little bit more later. We need more research on how drugs interact with each other. We need more research on the protocols. We need good research on the ways in which medications work on the brain and how the coming off process works. And so I would like to see on a federal level some leadership around this because it's a desperate need and it's not being met. And so I think it's really, really important that we also become advocates and activists and ask for this information, ask for that support, so that when you're in the hospital and when you ask your doctor, they say, oh yes, I know the information about this. Okay, that's your choice. Let me support you. Let's talk about this. Rather than, oh no, that can't be done. Oh no, that's not possible. Oh no, you must be on medication, which is the message that we often get. Because I feel, and I think it's pretty clear that it is more dangerous to not talk about this openly. It is more risky to not talk about this openly because people are frustrated with their medications and they don't have support, they don't have information, and they end up just trying it on their own without researching, without getting support, without learning. And that can be really risky. So in a free society, good medical policy, good health care requires the free flow of information. And so that's one of the reasons that this guide exists. And the approach that I take, it's very important. I mentioned protocols. And it's very important to understand that this is not a how-to guide. You can't come off medications like you're making a cake. You can't, it just doesn't work that way. And the reason is that we're dealing with the human mind. And we're dealing with society. And one of the things that we know from our lives is that everyone is different. So many of us have this label. I was diagnosed with schizophrenia, schizoaffective disorder, schizophrenia. How I experience that is going to be very different than how other people experience it. Sure, there are going to be commonalities. There's shared experiences. There's things there are patterns, there are things that fit, that I can say, hey, I have this in common with you, you have this in common with me. But everybody is different. And so this is not a recipe book. This is an educational guide that will help you to discover what works best for you and the people you're supporting to discover what works best for them by exploring. And it's one of the reasons that we have an image of a labyrinth on the beautiful cover on this guide, because everybody knows what a labyrinth is. A labyrinth is a maze that you walk through. It's a way of getting from where you are lost to freedom. And you don't know which way you are going to end up going. You have to explore. You have to try one way. You turn and try another way. Oh, that didn't work. You have to go back. You have to go forward. You have to really explore. And the pedagogical approach is a popular education approach based on people's experience. If you want to read more about popular education and learning and empowerment, this is a great book. How many people have ever heard of Pedagogy of the Oppressed? Going up. Isn't it a great book? It's a really great book to check out. So in that spirit, this is the first edition of the guide. And as you read it, you may say, hey, Will, you forgot to put this in there. Or, this isn't quite right. Or, this was written 2 years ago, and there's some new stuff that came out. Send that to me, because we're working on the second edition. And I would love your input. You have such incredible experience in this room, from medications, from being in the peer movement, the recovery movement. There's so much experience here and knowledge. Send me suggestions on what the second edition should include. It's going to be a little bit more expanded, a little bit updated, and we have the thank yous. We'll put you down as a thank you for contributing to the guide, and we really appreciate that help. Because, like I said, it really comes out of the recovery movement. It's really a collaborative effort. So, quickly, Robert Whitaker's speech you just heard. The standard of care around medications right now is, this is a disease, you need medications, that's the answer. And that is not based on good science, not based on good medicine. The science says that some people are helped by medications, some people are not. The standard of care for using medications, if someone is in a crisis, someone is in a wild state. I mean, when I was holed up in my apartment, not leaving, hearing voices, terrified of other people, thinking about suicide, wandering the streets all night. I was in a crisis and I needed help. And so the standard of care, what we should be doing for people is when they come into a hospital, they come into an encounter with helpers, we should start by just creating some safety around them and providing them with social support. And then see how it goes. See if they can ride it out. See if they can make it through their crisis with some emotional support, some peer support. It's incredibly helpful. And then, if they're still having difficulty, the next step would be to address sleep issues. Because that's one of the most important things that leads to crisis. A lot of people are nodding their heads. Is lack of sleep. And I tell you, large numbers of people, when they go into a crisis, all they need is help to get to sleep, and they will make it through. So let's start the medication around helping people with sleep. I would encourage not starting with medication, maybe starting with some herbs or some acupuncture if the person doesn't respond, then go to medication like benzodiazepines. And I know lots of people have questions. Let me just...
No, it's not a question. Oh. Why don't you first start with asking them
what
they need,
exactly.
And then going on.
That's exactly right. That's exactly right, yeah. The social support, peer support, and respecting people is absolutely right. And so I'm going to try and keep as much time as I can for comments and discussion. Everyone has great things to add, and I want to also make space for that. So helping people sleep will help people come through a crisis. And then if the sleep is not helping, if the medication or support for helping people sleep, then you start to say, okay, what else can we do here? I would say start with holistics, and then think about maybe small doses of medication. If that is helpful to people, then think about when there are people feeling better and stable and they can move out of the hospital, they're back into the community. You don't give them a framework which says long-term medication for life. You give them a framework that says, okay, that got you through a crisis. Now let's think about reducing, helping you going off medication. And based on this experimental approach, this standard of care would result in a lot more people not being on medication at all, a lot of people being on medication very short term, and then you're going to have some people who are going to be on long-term medication because that's going to be best for them. But I would love to see a lot of other things, peer support, social supports, holistic health added to that mix. That's the standard of care that we'd like to, that follows what the research says and what the medical science actually shows about how medications can be effective. So, as you can see, that's a not an anti-medication approach. That's not an either-or approach. In terms of thinking about this discussion, not in either-or terms, but in what works best for you terms, we came up with the idea of calling it a harm reduction approach. And people may know harm reduction, basically the message of harm reduction is that, look, we're going to meet you where you're at. we're going to meet you where you're at. We're not going to program to say this person should be totally off of medications.